Hello, good morning, good afternoon, good evening to everyone who's joining us. Nasaan man po kayo ng parte ng mundo. Welcome to our 67th episode of the Stop COVID Deaths webinar series brought to you by the University of the Philippines. We are glad that you're able to join us today as we continue to spread the word in terms of our credible online community that brings you more timely and informative topics on COVID-19 as we all together learn in this journey of our online community. And as the Philippines ramps up on the vaccination program, there have been reports of fully vaccinated individuals testing positive for COVID-19. And people are of course concerned, bakit po ba ako nagkakasakit pa or magkakasakit pa ng COVID-19? Ang mga breakthrough infections po bang mga ito ay talaga po bang rare occurrences katulad po ng mga sinasabi po sa media and made salient and prominent po sa mga social media accounts? I'm Dr. Raymond Francis Sarmiento from the National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Friday lunch date. And as always, I look forward to sharing hosting duties of our webinar with our adjunct research faculty, our partner in this webinar for a very long time already, and also the President's Special Envoy for Global Health Initiatives, Dr. Susie Pineda Mercado. Dr. Susie?
Hi, Raymond. Good afternoon. Magandang hapon po sa inyo lahat. I see we have so many people watching from all over the country. Binabati ko pong mga nakikinig sa SPMC, sa Palawan, our Metro Manila hospitals. Welcome everyone. I hope you're all doing well. And I know na, these breakthrough infections are really top of mind, no, Raymond? So welcome to our participants in Zoom, those of you who are watching on Facebook, and those of you who are watching on YouTube and on the playback. So we've got a great set of speakers today. Marami po tayong matututunan ngayon. Alamin po natin ano itong mga breakthrough infection na ito. Dapat ba tayo matakot? Ano ba dapat ang sabihin natin bilang mga frontline workers pag merong nagtatanong sa atin o nagsasabi, ba't pa kami magpapabakuna may nai-infect din. Ano bang sagot nating tama? So, marami tayong pag-uusapan ngayon. We've got great speakers. And we're gonna start, Raymond, with our person on the streets. It's always good to find out how people think about this topic. Raymond, over to you.
Thank you, Dr. Susie, for our person on the introduce and also for those for the benefit of those who are joining us for the very first time. The person on the street interviews put our discussion in context through the delivery of a short video created by TVUP. And for our interview video for today, the question would be, meron ba kayong nabalitaan na bakunado na pero nag-positive pa rin sa COVID-19? So sa tingin ninyo, bakit kaya siya nahawaan pa ng COVID-19? TVUP?
Meron akong nabalitaan na bakunado na pero nag-positive pa rin sa COVID-19. Pero office mate siya ng mother ko. Ang nangyari is tapos na yung fully vaccinated na siya. Pero nagkaroon pa rin siya ng symptoms kaya pinaswab siya nung municipal doctor namin. So doon nag-positive sa RT-PCR.
Yung mga family member ko po, mga vaccinated na pero nagka-COVID pa sila. Ate ko na buntis na hindi pa vaccinated, biglang lumabas na yung symptoms. Ang kasama ng ate ko, yung dalawang anak niya, tsaka yung mother ko, tsaka yung father ko. Tapos parang after 2 days, parang nagkaroon na rin sila ng symptoms.
Actually ako mismo, recently ako nabakunahan, tapos walang 2 linggo na infected ako ng COVID. Tapos oriented naman tayo na vulnerable yung unang mga araw, lalo yung unang mga linggo pagkatapos ng bakuna. Pero I had to attend an activity nung araw na yon. Actually yung mama ko rin po, nag-positive din sa COVID yung mama ko.
Sa tingin ko dito, bakit bakit nagkakaroon pa rin ng reinfection kahit bakunado na. Kasi lahat naman ng bakuna, hindi naman sa assurance na na hindi ka na may infect. Ang mangyayari lang kasi dito is magiging mild lang yung tama sa iyo nung nung virus.
Pinapabagal yung pagdami at pinapahina yung effect ng COVID-19 or pinapaliit yung posibilidad halimbawa ng severe cases and death.
Para sa akin talaga, wag talaga magpakumpante kahit na may vaccine na. Yung COVID talaga, nandyan talaga sa paligid lang, di mo masabi. Sa kamag-anak mo talaga minsan makikita, ayan, parang nangyari sa amin.
Oo, may nakikita akong hope na pwedeng maibalik sa dati or dahan-dahan nang bumalik sa dati yung galaw ng bawat tao, lalo na galaw ng industriya at ekonomiya.
Para din matapos, kailangan magpa-vaccine din lahat para hindi ganun kalala yung kung natamaan man ng COVID. Hindi ganun kalala, mild lang.
Naniniwala ako sa experience natin sa COVID-19 pandemic dun sa naging napakalawak na bayanihan ng mamamayan na may pag-asa naman. So marami tayong madodraw na lessons dito sa hinarap nating pandemic at hopefully ma-apply natin yung mga lessons na yun sa mga susunod. Halimbawa, yung pag-strengthen ng ating healthcare system na foundation talaga sana natin para maharap yung ganitong mga crisis.
Okay, thank you very much, TVUP. It's always good to get a sense of how people see it. And I think, Raymond, if we look in the chat box, we have a lot of disclosures, no? Marami time. Well, most of our audience are health workers, and they're reporting here that they have been vaccinated but have had an infection. So I encourage our audience, all of our participants, to ask your questions on the Q&A box. We've got some experts here who can answer your questions. And I hope we'll have more time to pick up questions later on, but I can see a lot are saying na itong situation nila, bakunado sila, pero may breakthrough. But I hope you're fine. I hope you're all okay. And yeah, Raymond, you wanted to, are we doing a Mentimeter, Raymond? We are, no?
Yes, we are, Dr. Susie. Thank you.
Okay, go ahead.
Thank you, TVUP. So for those who are joining us, yung mga nagwa-watch party po via the Facebook pages of the University of Philippines Stop COVID Deaths and TVUP, as well as those joining us in the youtube.com channel of TVUP, please also participate in our Menti poll, which is our opinion and fun poll po, no? Open your internet browsers and enter www.menti.com, and when you are prompted, please use the code 6632-2726. That's 6632-2726 for you to be able to participate in our opinion poll. For those who are joining us in the Zoom, numbering nearly 1,500 attendees, please wait for the Zoom poll to be flashed on your screens. Both the questions po na nasa Zoom poll and nasa Menti will also be essentially be the same po. So for those who are also slowly coming in, we want you to be able to encourage those of your family members, relatives, co-workers that the webinar is able to accommodate up to 3,000 participants. That's the maximum number of participants. So please join us in the Zoom so you can fully experience this interactive program. And for those who are also greeting us, maraming salamat po, no? We'll try to recognize you later on. And for those who are asking for ano po ba ang itsura ng mga certificates natin, nakatanggap na po ba yung iba at hindi po ako nakatanggap, please email us at stopcoviddeaths@up.edu.ph. The appearance of the certificate po is flashed on the screens and will be issued to those who have at least attended 50% of the webinar duration. Over to you, Dr. Susie.
Okay, thank you very much, Raymond. And I know some of you are waiting for that fun quiz, so we'll have that in a moment. But let's go straight to the meat of our presentation. We've got a very familiar face and voice for you to do the introduction or the welcome remarks for today. And kilala niyo po siya, one of your favorites. He is a epidemiologist, public health expert. And so I'd like to welcome the director of the DOH-KMITS, Knowledge Management and Information Technology Service, none other than Dr. Eric Tayag. Eric, welcome to the webinar.
Thank you so much. Magandang umaga, magandang hapon, magandang gabi sa inyong lahat. Thank you so much, Susie. Thank you so much, Raymond.
Eric, teka muna bago ka magsalita. Anong, I can imagine you're extremely busy. Okay, so you want to tell us what you do to relax?
What I do to relax. Work makes me relax. Parang paradox, ano? Okay,
Oo,
parang
paradox
paradox.
yata yun. Hindi totoo.
Okay.
Anong pang-relax nyo? I mean, especially, I know that the Department of Health is going through a difficult time now, but what do you
Okay.
do? What's your
Thank you,
advice to
ma'am.
our listeners?
I stick to a routine. Maaga akong natutulog. I make sure I have 6 to 8 hours of sleep. Okay, I wake up very early, around 3 or 4 a.m. That's the only time I read my emails so that it doesn't stresses me the rest of the day. Okay, and the food should be something that is satisfying. Okay, mahilig akong makinig ng music. Okay, before, nung wala pa yung pandemic, what helps me relax is actually listening to the music at pagbabasa ng libro. Okay, at on Sundays, yung pagsimba ko, Susi, helps me relax. Pero ngayon, matatawag na talagang stressful. Sa maniwala ka o hindi, for example, dalawang earphone ko kasi yung isa may hearing sa Congress regarding information system. Alam ni Doc Raymond yan. So, dalawang boses ang napapakinggan ko, yung boses ko ngayon at ang boses ng mga congressman po natin ngayon. What makes me relax is naka-focus ako so that everything is in place. Hindi ka kasi susi ma-relax kung you're not organized.
Right. So thank you very much, Eric, for those tips. I think that's very helpful for all our listeners. And somebody was texting me and asking if you have already created a Delta dance. Meron na ba yan? Meron na ba yan? Kaka-text lang sa akin eh.
Okay.
Okay. Sige, go ahead. Go ahead, Eric,
Okay.
with your...
Okay. Alam mo, marami nagtatanong sa Department of Health at kayo mismo nagtatanong, bakit naka-lockdown tayo, lalo na dito sa Metro Manila, ay patuloy pa rin ang pagkalat at pagdagdag ng mga kaso at mga namamatay. Unang-una po, may kinalaman po ito sa virus. Alam naman natin na ang Delta variant ay lubang nakakahawa po. At yan ay napanood yun na sa ibang webisode po ng regular na webinar na ito ng TVUP, Stop Deaths ng COVID. Pangalawa po, may kinalaman sa social mixing sapagkat tayong mga Pilipino ay ugali na natin talagang hindi mag-isa at may mga kasamahan po tayo na gusto natin ay makita man lamang at sa konting pagkakamali nga ay mari tayong mahawa. Anong pagkakamali? Pag hindi po tayo sumunod sa mga health protocol, katulad ng pagsuot ng mask, umiwas sa indoor muna, lalo na kung hindi maganda ang ventilation. At pang-apat, hindi pa po lubos na marami o sapat na mga nababakunahan. Ngayong araw, inyo pong matutunghayan, ang matagal nyo nang tinatanong, bakit yung mga nabakunahan ay nagkakaroon pa rin ng COVID infection? At ano ba tong breakthrough infection? Paano natin matatawag na isang tao ay merong breakthrough infection? Ito bang breakthrough infection, ibig sabihin niyan ay vaccine failure or pumalpak ang bakunang binigay sa atin? O baka naman may mga bakuna lamang, hindi naman lahat ng bakuna, ang madalas nagkakaroon ng breakthrough infection. So tama ba para isipin natin na ganyan yan? At dito gusto rin natin malaman, gaano ba karami itong breakthrough infection? Marami ba to o baka konti lang naman? At syempre tatanong natin, umuubra pa ba yung bakuna at meron ng breakthrough infection? Anong dahilan bakit nagkakaroon ng breakthrough infection? Tamang-tama po ang mga kasama po natin, si Dr. Regina, okay? Berba, ang ating resource speaker. Sasamahan po tayo mamaya ni Dr. Benilda Galvez, Atty. Maria Anthonette Velasco na ipapakilala po ng formal maya-maya lamang. Inaasahan po namin na kayo ay hindi po aalis sapagkat mamimiss nyo po ang mga kaalaman at paglilinaw na gagawin naming lahat sa araw na ito. Maraming salamat. Patuloy po tayong manood at makinig.
Thank you very much. That's Dr. Eric Tayag. Hang in there, Eric. I know it's, you're in the middle of a hearing and you're here. So we like to thank you so much for spending time with us this afternoon. Your audience loves you, who you can see on the chat box. So, okay. Raymond, magme-mentimeter ka na, mag-fun quiz ka na.
Yes, let's go, Dr. Susie. TVUP, may we have it on the screen? The questions po from menti.com. We are also flashing on the screens of those who are joining us in the Zoom. Dun po sa Zoom poll po natin. So please log in. We have nearly 1,700 attendees po dito po sa sa ating Zoom webinar. So hopefully all of them, or at least 90%, will be able to participate. We have two questions for today. The first question, a breakthrough infection is when one tests positive for COVID-19 after becoming fully vaccinated kapag nakalipas na ang option A, 1 week, option B, 2 weeks, option C, 3 weeks, and option D, 4 weeks. So, makikita po natin, medyo kalat-kalat po, pero may isa pong choice na napili po ang ating mga attendees na talagang they gravitate towards that choice. And then for our second question, so please input your answers for those who are participating as part of our Zoom poll and Mentimeter poll po, For our second question, it reads, fully vaccinated person may still get COVID-19, but breakthrough cases that lead to hospitalization and death are low. Ito po ba ay true o ito po ba ay false? So yun po yung mga kailangan po nating masaisip, and that's also one of the things that our experts in our webinar for today will be talking about. We'd like to greet those who are joining us all the way from James L. Gordon Memorial Hospital in Olongapo, from RHU Milaor in Camarines Sur, from Lambunaw Municipal Health Office in Iloilo, from the City Health Insurance Office in Cagayan de Oro, from Butuan Puericulture Center number 394 in Butuan City, Agusan del Norte. Internationally, also being joined here with us in this webinar, the Faculty of Medicine, Diponegoro University in Jakarta, Indonesia, Nagasaki University in Japan, the National Center for Global Health and Medicine in Shinjuku, Tokyo, the Institute of Biomedical Sciences, Academia Sinica in Taipei, Ministry of Health in Kuwait, Phang Nga, Thailand, Oman College of Health Sciences in Oman, Prince Mansour Military Hospital, Taif, Saudi Arabia, Al-Hana Modern Medical Center, Dubai, Neptune, New Jersey, the University of Fiji in Lautoka, Opal Healthcare, Meadow Springs, Australia, bago po iyon, nagiging regular na, Tunbridge Wells in Kent, England, Lunichi Ali University of Blida to Algeria, and St. Catharines, Ontario, Canada. We are seeing that there is, I think this might be our most responded to, participated in, Dr. Susie, kasi we are seeing almost 1,500 combination na po ng nasa Zoom poll at nasa Mentimeter ng mga sumagot. So for those who are joining in this opinion in the Mentimeter Zoom poll, maraming salamat po. We will tackle both questions later on towards the end of the webinar. Dr. Susie?
Yeah, thank you very much, Raymond, and thank you everyone for participating in the fun quiz. We're here to learn. We're here to be good examples of the right information, and I know you're very eager to listen to our next speaker. As we have been talking about from the introduction, we know that all of the vaccines are effective. All of them are effective, but we also know that it doesn't mean that you can't get infected. You can get an infection. And so I think we want to know more about why is it some people get infected? How do they get infected? Are there people who are vaccinated who actually have severe disease? what are the risk factors. Marami tayong gustong tanong. And I can see, Raymond, that in the Q&A box, we've got lots of questions there. So I encourage our guests to answer them to the extent that they can. But now we're going to listen to our expert, and you know her, you've met her, and she always calms us down because she's very calm. So I'd like to welcome the head of the Hospital Infection Control Unit of the University of the Philippines, Philippine General Hospital, Dr. Regina Berba. Nina, welcome.
Hello everybody. Magandang hapon po sa inyong lahat. I'm always very glad to be here and be invited. So, umpisahan na natin ang aking lecture today. Okay, so we'll be talking about breakthrough infections, but kaagad in the title page pa lang, I'd like you all to remember na vaccines reduce risk for severe breakthrough infections. No? So I'm sure we are all on the same page that the COVID pandemic has affected every aspect of our lives, and actually the number of confirmed cases and the number of lives taken by this virus is really, really phenomenal. No? So what I'll do is I'll just get some very important landmark documents from the United States, yan, from UK, from Israel, from Indonesia, at saka from the Philippines. Iniisip ko how I will talk about breakthrough infections kasi parang ang dami-daming information. So that's what I'll do, no? So to review, parang the USA is number 1, diba, sa number of total confirmed cases. And the United Kingdom also has a lot, over 6 million confirmed cases. For both of them, they have been using mostly Pfizer and Moderna vaccines. Israel, also Pfizer vaccines, no, with just a little bit over 1 million confirmed cases as of yesterday. So I wanted to look at what the experience was of Indonesia, who used a different set of vaccines, Sinovac primarily, and of course, zooming into our experience in the Philippines. So what are breakthrough infections? So sa Mentimeter, no, tinanong ni Raymond kanina. So to clarify, para our definitions are just standardized, CDC would say that a vaccine breakthrough infection is defined as the detection of the virus for this particular COVID-19. It's the SARS-CoV-2 RNA or antigen in a respiratory specimen collected from a person at least 14 days after they have completed all recommended doses of an EUA-approved COVID-19 vaccine. So ang sagot, tamang sagot dun sa Mentimeter question ay 2 weeks. Okay? Now, so going to the experience in the US, I think this particular paper that came out very recently, this month actually, on breakthrough infections actually happened in Massachusetts outbreak. So it narrated what happened, what led to all of the breakthrough infections. So, di ba, when they started to be able to rapidly give a lot of vaccines to many of its citizens, the United States actually brought down a little bit the degree of restrictions that they had. So they allowed people to go outside already without masks and have some kind of public events in different parts of the country. So in Massachusetts, there was an outbreak that was documented from July 3 to 17. Very brief lang to, 2 weeks. Tapos kailangan na nila i-control kasi they detected them already following multiple large public events in a county in Massachusetts. So that particular county already had a vaccination coverage of 69%, very close to the 70% herd immunity that we are all aspirating for. But nevertheless, they saw 469 COVID-19 cases and from that pool of COVID-19 cases, 74% were actually fully vaccinated cases. So it really brought a lot of concern for many of the people in the Massachusetts area. And when they looked at, they studied sampling of 133 patients who were able to submit their respiratory secretions for whole genome sequencing, they found out that 90% were already because of the Delta variant. So parang we already see what are the ingredients for these breakthrough infections. No? So very early on, the Massachusetts Department of Health was able to quickly detect and follow through the events that seemed to show that there was really a rapid rise in the number of cases. So parang nag-open sila, nag-invite sila ng mga public events, no? Yung mga race, horses, yan yung nangyari sa Massachusetts. And quickly they were able to stop all of these events in an effort to control the ongoing outbreak. They found out that most of the cases were male, 87%, and the median age was 42. And the distribution of this were because yung mga public events nila invited mostly males and mostly this group of middle-aged people. The vaccines that were received were mostly Pfizer, Moderna, and Janssen, as indicated here. And 79% reported signs and symptoms, mostly cough, headache, sore throat, myalgia, and fever. They said that most of these were mild. Only 4 of all of these cases had to be hospitalized. So mababa yung hospitalization rate, which was only 1.2%, and no deaths were reported. But because of this, they also tried to compare the city values of, city value is a number we use in infectious disease when we're trying to see just how infectious or communicable certain samples are. And usually the lower the city values are, the lower, that means it only takes a few cycles for the machine to detect the virus in the sample. So ibig sabihin mas madami na siyang virus. The viral burden is heavier when the city values are low. So you would see here that it didn't seem to matter kung unvaccinated or vaccinated yung individuals, no? So the infectiousness looked the same. So what happened? Because of that very important outbreak and the subsequent paper that came out from describing the experience, the CDC now recommends that back na sila sa wearing of the mask. So CDC started to recommend that even if you are fully vaccinated, if you are indoor in public settings, you should wear masks, no? And that reverberated throughout the country. And yun nga, there are more and more concern about this particular breakthrough infections, and we should really all continue to update ourselves. So maraming information, mostly in news items, but there's also a good resource from the CDC, MMWR, to keep ourselves updated. Okay. Let's go naman to the UK, the United Kingdom experience. This is the paper I thought would help us understand better what's happening with the breakthrough infection. So these are effectiveness against the Delta variants. So this is a description of symptomatic disease. The design of their study was a test negative design. And the people who did this study were associated with the Public Health England. Siya yung parang equivalent ng Department of Health natin. And you would see in this graph, they tried to map out the vaccine effectiveness for the Alpha and the Delta variant after the first dose and the second dose. And you would see na may malaking difference, no? So if we just receive the first dose, the protection is only around 30% to at most 50%. But it rises very significantly if we finish the recommended number of dosing. So although it doesn't match breakthrough infections, no, so don't get disheartened if you get an infection in between the doses, because that really happens because our level of protection is not yet full. If we only stop at the first dose, we really should make every attempt to finish the recommended number of doses. So here, after the second dose, you would see that both for Alpha and Delta variants, the vaccines that this group of population received were effective, up to 79 to 89%. So the conclusion of this experience from UK is that there's high levels of vaccine effectiveness against symptomatic disease with the Delta variant. If for their population received the Pfizer or the Astra COVID-19 vaccines, and that there's reduced effectiveness if we only receive the first dose. So if you know of other people who might stop at the first dose or get disappointed because they got an infection after just the first dose, prod them to go and finish the second dose or the number of recommended doses. Okay. Punta naman tayo sa Israel, no? So sa Israel, I really try to look for this information about what they experience as breakthrough infections, because Israel actually is the #1 in terms of coverage for COVID-19 vaccines. And the report here narrates to us the experience of the largest medical center in Israel, which is the Sheba Medical Center. At the time they did this study, the vaccination coverage was already 91% for their hospital. And this took place over 14 weeks from January to April of this year. So very, very fresh information. So they wanted to see and identify every breakthrough infection, including asymptomatic infections among their healthcare workers. And it was a matched case control analysis. So what did they see? There were 11, ganun kalaki yung medical center nila, no? They had 11,453 healthcare workers. They were doing PCR tests whenever the healthcare worker would have been exposed or would have any symptom. And among this, they only saw 39 breakthrough cases, or 2.6%. And the characteristics of the healthcare workers who developed these breakthrough infections were mostly nurses, people who were coming in and out of the wards, like the maintenance workers, some allied health professionals, and physicians. The average age was 42 years old, and there was some increase in the incidence among women. Okay. The median interval from the second vaccine dose was 39 days. And only one person was infected who had immunosuppression. Saan kaya nakuha yung infection? No? You would usually ask, where did the healthcare worker get the infection? So the Israel group described the breakthrough infection origins mostly from unvaccinated persons around the healthcare workers who were already fully vaccinated. So 57% got it from an unvaccinated household member, like children or other household members who were still unvaccinated. And 30% got them from unvaccinated fellow, yung colleagues, no? Fellow healthcare workers or patients. And they were able to track 7 healthcare workers who were linked to a patient who had the Alpha variant. At the time kasi, Alpha variant pa yung predominant in Israel. Okay? And again, when they describe the severity of the symptoms, 67% were mild, and the rest were asymptomatic. So very, very mild, no? Kung meron man, mild mostly. Non-required hospitalization, and the most common symptoms were upper respiratory congestion, myalgia, loss of smell or taste, and 21% reported fevers or rigors. What happened to them? So it said that 31 after the 14 days, some still had residual symptoms. 1/5 actually reported having the long COVID-19 symptoms, so prolonged loss of smell, persistent cough, fatigue, weakness, dyspnea, or myalgia. 1/4 of those who had the infection actually had to take a leave of more than 10 days, longer than the isolation period that we recommend. And there was one worker who was not able to return despite 6 weeks of leave. So ang conclusion nila was, the variants of concern, as I said, mostly were alpha variant, because at that time 94.5% of the Israeli samples had the alpha variant. So ang conclusion nila was the Pfizer vaccine for them was extremely effective, and they actually called, kasi 2.6% in this particular healthcare worker population, that the breakthrough infections were rare in incidence. But of course, they sort of give us a challenging situation because many are mild or asymptomatic and may pose a risk for vulnerable populations in a medical health facility. Okay, now going to, syempre tatanungin nyo, paano naman yung sa hindi gumagamit ng Pfizer or the other, they call it first world country vaccines. If you look at the more recent news items from Israel, they've been identifying that breakthrough infections may be more severe, no, in sicker patients, in older patients, in patients with comorbidities. So that's something to keep in mind, and that's something to make us again always more vigilant for our vulnerable populations. Oh, yeah. Ito na talaga, pupunta na tayo sa Indonesia. So we've been hearing this since around the end of May to early June, how Indonesia was like just swamped with so many cases of COVID-19. And we heard about why hundreds and hundreds of vaccinated healthcare workers actually came down with the breakthrough infections. No? So actually, if you, or maybe I didn't find them, but I tried to look for them. There was only one case report so far, and of how it was that Sinovac recipients would anyway end up with breakthrough infections. And this letter to the editor published in this particular journal tried to tell us that when they measured the antibody responses of this particular infected healthcare worker, there was a decline in the antibody response at the time that she had the SARS-CoV infection. So in conclusion, for that Indonesian paper, the possible factors for breakthrough infections included maybe lack of immune response from different kinds of populations receiving the vaccines, and the occurrence of variants of concern in the country. Ayan, punta na tayo sa Philippines, no? So sa Philippines, so far, I really have only healthcare worker data from the Philippine General Hospital. This is our epidemiologic curve of what's been happening lahat to healthcare workers through the 18 months that we've been fighting the COVID-19 as a referral center. So meron kami talagang naging surge very recently when the August month came about. And this is the number of healthcare worker breakthrough infections we've had so far. And that amounts to about 71% of all the COVID infections we've had with healthcare workers. This one we did last night. We completed this data collection and infographic last night. This is not healthcare worker. These are our current patients in PGH. And in the first set of dots, we were trying to represent persons who were fully vaccinated. Sila yung green. Partially vaccinated, they are represented here as yellow dots, and the unvaccinated as red dots. And you would see na yung green did not proceed to the intubated, critically ill intubated COVID cases. So meron din COVID critical, pero as far as we know, as of this morning, they are sort of okay and hanging in there. The ones that really become very, very sick are the unvaccinated or the partially vaccinated individuals who proceed to being critically guarded and intubated. So segue lang ako to saying that our information here in the Philippines is not yet complete enough for large completed studies kasi ginagawa pa lang natin sila. So we've started to organize ourselves to have this vaccine effectiveness or Philippine VE project. There's a lot of people who will be part of this all over the country, and we're going to look at how the vaccines may be the key to end the COVID-19 pandemic. So ang titignan namin would be a real-world vaccine effectiveness data. We will be collecting them in the next 12 months. And the project will be trying to estimate effectiveness of the COVID-19 vaccines amidst all of the different vaccines we've been using in the Philippines. We're already on our third month by September to October. So siguro, kung iimbitahin niyo ako ulit, makakabigay na ako ng more complete data on this. And the project design is a prospective cohort of 12 sites. More or less, this VE project will look at 2 arms. There will be antibody testing or immunosurveillance. This is not to say na people should go around getting their antibody levels. We recommend this only as part of a research or a clinical study. And the other arm would be looking at COVID-19 surveillance. Exactly sino ba yung symptomatic at saka sino yung nagkakaroon ng asymptomatic infection. So for PGH, we've started to do the antibody test, but again, under a clinical study setting and looking at the incidence of COVID-19 hospitalization and death among PGH healthcare workers between vaccinated versus unvaccinated individuals. So this is already my second to the last slide, but I hope through all of the slides, I've been able to show you through the experiences of the USA, the UK, Israel, Indonesia, and a little bit from the healthcare workers in PGH, that COVID-19 vaccines are effective, but many factors really come into play and that make us more prone to breakthrough infections, including host factors like comorbidities, our immune responses, situation factors like exposures, use of protection, and virus factors like the presence of variants of concern, and of course, the properties of the vaccines that we use. Okay, that's it. So kasama ang sambayan ng Pilipino laban sa COVID-19 pandemic. Thank you very much for listening to me.
Thank you very much. That's Dr. Nina Berba, the head of the Infection Control Unit of the Philippine General Hospital. Ang husay talaga ni Nina, no? Parang napakalinaw at napaka-klaro ng pag-explain niya ng situation. And factual, I think it's really good to see what's also happening in other parts of the world. And also great to hear na meron tayong mga sariling pag-aaral, no, dito. So abangan namin yan, Nina, yung results ng prospective study nyo. Okay, Raymond, let's go to our next speaker.
Thank you, Dr. Susie, and thank you for the comprehensive presentation. Surely, mamaya sa Q&A, Dr. Nina, marami pong mga katanungan for you. So, abangan po natin yan. We look forward to our panel discussion later on. But first, we have a couple of reactors bringing different perspectives po to the table. Our next speaker is a retired manager of the Pulmonary Critical Care and Sleep Medicine Department of the Lung Center of the Philippines. Please welcome to the webinar si Dr. Benilda Galvez po. Dr. Galvez? Ma'am, you're on mute po.
Good day to everyone. Thank you for inviting me in this special edition of webinar, which is a special topic of concern, which is breakthrough infections. Okay. Well, Dr. Berba has presented adequately about breakthrough infections and has given their data at UP PGH regarding breakthrough infections. Now, I was tasked to give some raw data on our experience among healthcare personnel at the Lung Center of the Philippines. Okay, the Lung Center of the Philippines is a designated COVID referral center, especially for moderate to severe and critical cases. Okay, so since the start of vaccine rollout in the Philippines, we were among the first who were given the first batch of vaccines last March, first or second week of March. And we have completed our vaccination around May for the AstraZeneca and earlier for the Sinovac. Okay, may I have my first slide, please? Okay, thank you. Okay, so since March up to August 2021, okay, we have already completed 2 doses of 1,029. Okay, so 1 dose, second dose to be given at 157 personnel. Okay, and 22, for whatever reason, still refuse to have their COVID vaccination. Okay, so currently, we can say that our fully vaccinated personnel would be around 85.2%. Okay. However, once the 157 have completed their full vaccination, second dose, we can increase that to 98.2%. Now, when will the second dose be given? We're expecting the second dose to be given by around the first or second week of September. Okay. So please take note that we gave vaccination not only to our healthcare workers, but to all personnel, meaning to say those in admin offices, janitorial, and even our security personnel. So they are included in this LCP personnel vaccination program. So how do we fare with our breakthrough infections? Next slide, please. Okay. This is the raw data with breakthrough infections among our healthcare personnel. So as I mentioned, we completed our second dose of vaccinations around May. So if there will be breakthrough infections, that will be 2 weeks as defined, 2 weeks after the second dose has been given. So this is our data from June 1, 2021 up to the recent August 22, 2021. Okay, please take note, this is from June, July, and August. As you can see from the slide, okay, we have among the vaccinated, we have 8 versus the 3 in the non-vaccinated for June. For July, we have 11 in the vaccinated group and 3 in the non-vaccinated group. However, in August, there seems to be a surge among the vaccinated, 46, and non-vaccinated, 13. Okay. I would surmise that the surge in August coincides with the surge of cases in the community. Okay. So for these 3 months, at least up to August 22, we have a total of 65 among the 1,029 personnel who were vaccinated, giving us a rate of 6.3%. In contrast, in the non-vaccinated, we have a total of 19, giving us an infection rate of 10.6%. Take note that still the breakthrough infections, there are more infections rather in terms of personnel among the non-vaccinated personnel. Next slide, please. Okay, now majority of our cases in June and July were all mild symptoms or asymptomatic. There were no moderate or severe or critical cases in June or July. However, during August 1 to 22, we were able to have one severe case in the vaccinated group. This one severe vaccinated group who completed his vaccination is a 58-year-old non-healthcare worker. She's works in the engineering department, but has hypertension and is obese. Okay. Versus those in the non-vaccinated, we have one severe case who is a 50-year-old but has since recovered. Now, the present case of one critical in the non-vaccinated group. So, for percentage in the severe or critical breakthrough infections, we have a 0.01% in the vaccinated group, whereas the incidence of infection in the non-vaccinated group is 1.12%. Okay, so where do we go from here? Okay, we will try to increase further our vaccination rate from the 85% current to the targeted 98% once we have the one dose personnel, 157 personnel who are due to have their second dose completed by September. So just like in the literature, I think the variant of concern, specifically Delta, possibly drove the increase in our breakthrough infections despite being vaccinated, particularly during this August. Okay, so this, however, this should not discourage people from getting the infection. Still, it protects patients from getting severe or critical or even landing in the hospital. At least it protects you from going to have deaths. So this is my last slide. I hope I was able to give you a brief overview of the status of breakthrough infections, at least for the last 3 months at the Lung Center of the Philippines. Okay. Thank you for your attention.
Okay, thank you very much, Dr. Galvez, Benny Galvez of the Lung Center of the Philippines, for sharing that information. And I think we are very, very, very fortunate to have you here to share that. And we do hope to be able to get more information from the other hospitals as we progress. Okay, so we go to our next reactor. And ang sabi nga natin dito sa webinar, lahat ng talino kailangan po natin para maagapan natin itong COVID. No? Hindi po pwedeng puro tayo lang dito sa health sector. Napakahalaga po na lahat po tayo nag-iisip ng solusyon. And recently, there was news that 95% of the tourism sector in the National Capital Region has been vaccinated. So we thought we were going to invite someone who could talk about that. And she's not a doctor, but she has been working in the health sector. I've known her for the longest time. Even when she was a law student, she was part of the team of Secretary Flavier. She's a lawyer, and she is currently the Chief Operating Officer of the Tourism Promotion Board of the Department of Tourism, but she has handled many, many different positions in government. She's well known to all our civil servants because she was the head of the CES board. And I've seen her grow and rise and become a leader in Philippine government, and we are just so happy. Raymond, ka-Toym award din ito, ha? So, I'd like to welcome Attorney Anthonette Velasco Aliones. Anthonette, welcome to the webinar.
Really my pleasure, Dr. Susie, Ma'am Susie, my former boss, my mentor, and yeah, si Doc Raymond, magkakilala kami because I chaired the screening committee for his batch, di ba, Doc?
Ay,
Congratulations. Yeah.
na.
Maraming salamat sa introduction mo, Ma'am Susie. Fun Friday sa mga kasama natin sa webinar. Ninenervous ako kanina, sabi ko, bakit ako nasali dito? Parang mga experts ang nandito at ang mga datos, ang mga statistics, parang naligaw ako dito. So kahit naliligaw ako, may connection tayo pagdating sa usapin ng bakuna. So kung nasan man po kayong gawin ng Pilipinas, may mga nasa ibang parte ng mundo pa na nandito. Maraming salamat for joining kasi it's important that we continue to share information, get ourselves updated. And as I share my slide, I'll walk you through some of this and why I'm probably here for the tourism sector. So vaccination, masabi ni Doktora, may mga breakthrough infections, pero alam niyo yung kailangan din namin ng breakthrough para ma-break yung barriers to tourism recovery. And vaccination actually, fortunately, is considered as one of the key game changers. Binabago niya yung laro ng paano magbubukas ang turismo sa iba't ibang parte ng mundo. Siyempre, sarado pa po lahat. May mga matatapang na mga nauunang nagbubukas pero nakikita po natin sa karanasan natin para tayong close open, magbubukas, may kung ano-anong mga pakete, tapos may search ulit, magsasara. Pero siguro na tinatanong nyo, bakit pa kasi kayo ganyan? Baka nakaka-contribute pa kayo dun sa mga infections, no, sa transmissions. Pero malaki po ang contribution kasi ng tourism sa ekonomiya sa ating bansa alone. Nako, 12.7% po ng ating gross domestic product contribution ng turismo. 5.7 million workers ang nasa turismo. Last year, 4.8 of them, kung hindi po nawala ng trabaho altogether, ay nabawasan ng oras ng pagtatrabaho at ngayon ay kasama sa mga naghahanap, no, ng kabuhayan para maitawid ang pangangailangan ng pamilya. So, ganyan po yan ang kahalagahan ng turismo. At kaya kami siguro nandito ngayon, and as I speak actually, si Secretary Berna Puyat nasa Siargao ngayon, balikan siya, no, precisely to roll out vaccination for our tourism frontliners. Dahil as I mentioned, vaccination is really key to opening the doors to tourism recovery. Across the world, last month, noong July, nakita natin may 4 na bansa na mas innovative at siguro mas matapang, no? At may mga excess silang vaccines. Nag-offer ng mga pakete. Sa US, nauna yung New York, yung picture na yan sa kaliwa, yan po yung sa Times Square, no? May mga sila doon, tent. Pag ikaw ay dumating na turista, babakunahan kanila. Ginaya sila ng Alaska, sa Arizona, Louisiana, Texas, and even Florida. At sa Maldives naman, yan, meron pa silang package. Visit, Vaccinate, Vacation Package. O, di ba? Kasi pinaplano nila pagdating ng next summer, dahil sila ay summer destination, makakainganyo sila ng mas marami pang turista kasi nga sadsad ang ekonomiya nila. Dito po sa Rio natin, sa Southeast Asia, ang Bali sa Indonesia, dahil heavily reliant po ang Bali sa international tourism, ay nagbukas din ng pakete, although hindi pa ito fully rolled out dahil nagkaroon sila nitong breakthrough infections, yung latest surge. And the latest news is that President Widodo will be the one to make an announcement as to when they finally roll out this Bali package. And of course, Russia, with its own Sputnik Gamaleya vaccines has been quite strong also in offering packages for tourists. Although ang isa pang barrier nila din of course ay yung mga entry or visa requirements. So makikita natin may 4 na bansang nangunguna dito sa usapin ng pagdikit ng turismo at vaccination. Although alam din naman natin na like the UNWTO and certain organizations did not receive this positively dahil sinasabi nila na parang syempre may mga moral or ethical questions dahil marami pang parte ng mundo na wala ngang access to vaccines at sana'y mauna nating ibigay yon kesa dun sa mga ganitong ang mga activities or adhikain na mag-promote lang ng tourism. So, the road to recovery of tourism globally faces certain barriers, and top of that would be the travel restrictions that we still face, and that's largely influenced by how governments or countries are able or not able to control the cases. So it's really crucial how we get the information out in terms of our cases on a day-to-day basis, how we're able to respond to this through capacitating our public health systems. And of course, the economic environment of the country is also a factor for concern. Dito, when we zoom in sa Pilipinas, ang epekto po ng pandemya ay malaki. Ang ating foreign visitor arrival bumagsak by 82% last year alone. At ang ating tourism receipts, yung mga ginagastos ng mga turista na contribution nga sa ekonomiya natin, bumagsak din po yan by 81.96%. That's why I said, apektado po talaga ang mga kasama nating manggagawa. Lahat po yan, yung mga bankero, yung mga gumagawa ng souvenir, yung mga nagtitinda, yung mga nagnenegosyo. Yung suot t-shirt ngayon, negosyo ito ng isang tour operator na sinusuportahan natin kasi para tuloy-tuloy lang sila, maka-cope naman dun sa mga challenges. So, ito yung challenges. These are the barriers to recovery. But looking ahead, for us, our travel sentiment survey, we ran 2 surveys last year with the AIM. The trends point to number 1, domestic tourism will lead our recovery. And that's an advantage for the Philippines, unlike other countries that are fully reliant on international tourists. Actually po tayo, sekreto natin sa Pilipinas, atin na lang. Yung 10% of the 12.7% na contribution sa GDP, yun po ay domestic tourism. So in 2019, that translates to 110 million domestic trips. Kaya gusto rin nating mainggan yung mga kababayan, magsibiyahe na muli, matulungan natin yung mga destination makapagbukas ulit. At crucial po dyan yung pangalawang factor na increased digitalization at paggamit ng social media. So ngayon, virtual tours to entice people to, visit the destinations kahit virtually muna. But we are also capacitating the sector para magkaroon ng mga contactless booking, contactless payments, lahat po ng mga paggamit ng technology para maging safer yung travel and tourism ginagawa natin. At sabi ni Doc Susie kanina sa umpisa, well, top of mind concern. Hindi lang po ng general population, more so for tourists, ay health and safety ng ating mga destinasyon, ng ating mga workers. At pati po niyan ang pagbabakuna. Kung kaya si Secretary Berna, ginawa niya po talagang priority advocacy na ma-vaccinate lahat ng mga manggagawa sa turismo. Beginning with my own office, the Tourism Promotions Board. Lahat po kami ay fully vaccinated as of last month, July. 3 na lang ang hindi nababakunahin dahil ito naman ayaw naming pilitin kasi may history of severe allergies at so walang mga clearances from the doctors. But otherwise, there is no hesitancy. Lahat kami gustong mabakunahan dahil lahat po ng biyahe namin, hindi namin pinalalabas ang mga hindi fully vaccinated. Mayroon din po kaming mga frontliners, parang mga medical workers, hindi lang sila nasa hospital, sila ay nasa hotels that are being used as quarantine facilities or isolation hotels. Karamihan po ng mga infections among tourism workers nangyayari dun sa mga hotel which cater to mga returning overseas Filipinos during the quarantine period in case may nag-positive o yung ating mga returning overseas Filipino workers dahil nga po karamihan ng hotel na ikayat naming mag-shift muna in the meantime na maging quarantine hotels ay doon po sila nagtatrabaho. Out of the target na 32,467 workers for these facilities serving as isolation and quarantine hotels, konti na lang po, less than 20% na lang, 17.98% as of August 20, ang hindi pa bakunado. And then for all the other hotels naman, across the country, ito po yung, syempre, nagko-compete kami sa access, no? Medyo nasa 33% pa lang ang pagbabakuna, pero Yan po ang kadahilanan kung bakit umiikot si Secretary Berna, particularly for the priority areas. Ito po yung priority areas. NCR, dahil tayo po ang gateway, dito naman talaga karamihan din ang gagaling ng mga turistang bumibisita sa iba't ibang dako ng palit ng Pilipinas. And that's the NCR plus 8. So there are 8 provinces or areas that are priority tourism destinations. Most people frequent them: Baguio, Pampanga, of course Palawan. There's Coron, El Nido, Puerto Princesa in San Vicente, no, also. And then of course Boracay at Bohol, Siargao. In fact, Boracay po number 1 sa listahan ng ating domestic tourism destination since it reopened in October last year. And for that, kaya po kami nagbigay ng suporta sa Malay Aklan para may subsidy tayo. Yung mga workers po doon tinitest regularly sa RT-PCR, at nagbigay na rin po kami, nag-roll out ng subsidy for tourists coming from NCR to visit the other destinations. Pa kailangan nagtitest din sila before travel. So the way forward really compels us to carefully navigate, mindfully navigate the way to the better normal for travel in tourism. And that requires these factors of doing our share of responsibility to get vaccinated, observing the minimum health protocols of wearing mask, face shield, the hygiene for the hand washing, and of course, observance of the distancing, especially if you are in a crowded place. And for tourism and travel, we support and encourage LGUs to really require as one of the protocols yung test, a negative RT-PCR test before travel, not even antigen, because we still want to follow the gold standards. So this is actually the last of the second to the last of my slide. The last one is an AVP that we developed last year, but just by way of, in a fun way, contributing to heightened awareness and consciousness on the observance of our health protocols. So I hope you enjoy sorry, let me go back. Nagmamadali naman yung aking video. Thank you very much, Dr. Susie, and I'll be happy to join the panel later for some questions.
Okay, thank you very much. I'm sure you all enjoyed it. And okay, Raymond, parang sabi ko, nagugulat sila, Mr. tayo talagang, kaya sabi natin lahat ng talino ng ating bansa ay kailangan nating gamitin, right? And I think, Anthonette, you can see all the, all the positive comments on the chat box. I think they found it really very, very interesting, and we're looking forward to more discussion as we open the panel. Okay, Raymond, over to you.
Thank you.
Thank you so much, Attorney Anthonette, and also Dr. Susie. Nagising po ako dun sa video actually for that, and that's something that we really thank the Tourism Promotion Board po for sharing with us the learnings and also their plans and what they have done as part of the vaccination program, and really how to protect all of us moving forward. So thank you for that, Attorney Anthonette. So at this point, may we ask our panelists to please switch on your videos po so we can begin our panel discussion. Calling po Director Tayag of DOH, also Dr. Nina Berba, Dr. Benny Galvez. Attorney Anthonette already has her video on. And before that, very quick lang po, no? Quick break for our special public service announcement which we have been doing for the past few weeks. Over to you, TVUP.
Mahalaga ang lakad na ito. Tigasin ka ba?
Siyempre!
Mahal ba si Commander?
Mahal na mahal! Pare, mahal mo ba ako? Oo naman, ano?
Mahal mo ba ang tropa?
Oo ba?
Tara na! Magpapakuna na tayo!
Dahil mahal ko kayo, magpapabakuna ako.
Okay. Thank you so much, TVUP. The COVID communication.
Nakikita talaga ako dyan sa PSA na yan eh. Talagang tigasin talaga sila.
So, the COVID Communication Public Service Announcement is one of the many outputs of the UP research entitled Communicating COVID-19 in Post-Quarantine Philippines. It's headed by our Vice President for Public Affairs, Dr. Neni Pernia, and funded by the DOST, Philippine Council for Health Research and Development, and the Department of Health as part of the AHEAD program. Over to you, Dr. Susie.
Okay, Raymond. I think let's start with the Mentimeter. Although I think Nina answered the questions, but let's just go through that quickly.
Yes,
Yeah,
po.
go ahead. Sige,
Thank
Nina,
you.
ikaw
There we go. Dr. Nina, this will just be a reiteration po, no? Pero for the benefit of those who are in our Zoom po, who are numbering, well, past 2,000 na po tayo, and for those who are joining us in other channels, what's the answer to this question? A breakthrough infection is when one tests positive for COVID-19 after becoming fully vaccinated pagkatapos ng 1 week, 2 weeks, 3 weeks, 4 weeks.
2 weeks.
2 weeks. Thank you so much, Ma'am Nina. And then, true or false? Thank you, TVUP. True or false? Fully vaccinated individuals may still get COVID-19, but breakthrough cases that lead to hospitalization and death are low. Is that true or false, ma'am?
True.
Okay. Thank you so much, Dr. Berba. Okay. Let's get the ball rolling, Dr. Susie.
Okay, so I think I'm looking at the Q&A box, and I think we have 70 questions. But let me just start off by asking everyone about. Well, I think this webinar is good because I think what we're saying is that yes, you can get a breakthrough infection, but no, you don't have to be so afraid of it. Nina has talked about mild symptoms. I think so has Benny Galvez of the Lung Center. But I guess the thing is people have a kind of expectation that if you get vaccinated, you can't get infected. So maybe I'm gonna start with Eric. Na this is now in the realm of risk communication. When we start communicating, how can we counteract the idea that the vaccination completely protects you? Di ba? Parang ganun eh. Parang, yung mga, ito, we're talking about people who are resistant, no? Ba't pa ako magpapabakuna maaari naman ako magka-infection. So I'll start with Eric. Eric, how do we change that it's a wrong expectation kasi. Parang gano'n ang team ko parang mali yung expectation. Sige Eric, ikaw.
Okay, unang-una, Susie, maraming salamat sa lahat na kasama ko ngayon sa panel. Unang-una, Susie, walang bakuna na 100% effective. Pero hindi ibig sabihin na walang 100% effective ay hindi tayo magpapabakuna sapagkat napatunayan na hindi pa ang dumating ang pandemic sa atin ay malaking halaga po ang premium na binibigay natin sa bakuna sapagkat marami ng pagbababa sa mga namamatay sa mga nakakahawang sakit at na-eradicate na natin smallpox at ngayon malapit nang ma-eradicate ang polio. Pangalawa, sinasabi po natin na ang ating katawan ay gumagawa ng antibodies pag tayo nabigyan ng bakuna. Subalit kailan maintindihan natin na hindi dahil sa bakuna kundi sa ating immune system. So kahit anong gawin natin, yung bakunang yan, hindi lang COVID vaccine, yung ibang bakuna, ay talagang 2 weeks matapos yung complete schedule ng vaccine at magkakaroon tayo ng antibodies. Anong ibig sabihin yan? Sa mga panahon na hindi pa tayo protektado o pinaliliwanag ko sa inyo huwag kayong magpapa-selfie kung second dose na sapagkat 14 days after pa po ang protection. So anumang araw between the first dose at saka yung second dose, kung hindi tayo nag-ingat, hindi tayo nagmask, naghugas ng kamay, physical distancing, ay mahahawa po tayo. Ngayon, itong breakthrough infections ay expected po to. It's not something na parang tinago po ng mga eksperto. Sapagkat sa ibang bakuna rin, ay nangyayari po yan. Ngayon, kailangan nyo po maintindihan, kung kayo po ay nagkaroon ng COVID, bago pa yung 2 weeks after na may protection kayo, ibig sabihin niya na unahan po kayong mahawaan bago pa kayo nagkaroon ng protection. Ngayon, after 2 weeks at nahawa po kayo, ibig sabihin niyan ay isa kayo sa mga sumusunod. Una, maaring mahina po ang ating immune system kaya hindi masyadong maganda yung antibodies na na-produce. Pangalawa, baka naman sa katagalan, kasi hindi lang po ngayon binabantayan katagalan yung bakunang natanggap natin, bumabagsak na rin yung immunity na makukuha sa kanya. At pangatlo, itong mga variants, hindi lang Delta at yung mga lalabas pa. So may salita, Susie, ini-expect natin yung breakthrough infections, pero hindi lahat magkakaroon yan. At yung bakuna ay makaka-protect sa atin sa severe COVID. At kung magkakasakit, nakita naman yung mga datos, ay isang sitwasyon na hindi tayo dapat mag-alala. Thank you, Susie.
Okay, thank you. Thank you, Eric. Nina, can you comment on that? On how do we change the mindset na okay lang to? It's okay.
You're muted po, Doktora.
Part of your expectation talaga yung nag-go ka through the effort of pila sa online, tapos pila pa ulit sa vaccination center, parang naturally, we expect na, naku, hindi na sana ako ever magkaka-COVID-19. So, tama po kayo, dapat very clear natin iset yung expectations. What we're really trying to do is to reduce yung risk na hindi tayo kailangan ma-admit, hindi tayo kailangan maging critical, hindi tayo kailangan mangailangan ng oxygen should we come down with COVID-19. Parang ganun dapat yung mindset natin. At malaking bagay yung kasi nakakatakot talaga ma-ospital at mga ilangan. Yung pag dinidescribe po sa akin ng mga pasyente, yung air hunger nila, parang nakakatakot yung sensation ko na yun. So, I think, even if we feel we're healthy, wala tayong comorbidities, yung fact na we are parang taking away or at least significantly reducing that risk na mapunta tayo sa situation na yun, malaking bagay na po yun.
Yeah, thank you very much. Sige, pasok
Can I add? Can I add? This is experiential. And also related to tourism, sa marketing. So una, importanteng we get the correct influencers kasi there's so much information out there that cause people to fear the side effects of the vaccine. My very own driver, noong July ko lang na-discover, hindi pa pala siya vaccinated. Kuya, ba't di ka nagpa-vaccinate? Nagpalista na tayo lahat. Kasi po, ma'am, sabi, magiging zombie daw ako. Di ba? Talagang gusto kong kasalanan ko yun. Sabi ko, ang dami-dami kong nako-convince. Tapos yung sarili kong nagmamaneho, akala niya magiging zombie siya. So, nung nagpabakuna ako nung as early as April at nag-post ako sa Facebook, sa social media, a lot of my colleagues in government reached out to me sa messenger, private messages. Sabi nila, kapatid, anong nangyari? Bakit ka nagpabakuna? Wala ka bang side effects? Sabi ko, bakit? Bakit kayo lahat ganyan? Kasi ayaw talaga namin. Pero nung nakita ka namin na nagpabakuna ka na, sabi namin, matalino naman tong babaeng to. Siguro hindi siya susuong dyan ang hindi niya alam yung mga risks and benefits. So it's important that we get influencers out there to give the information, correct information. And as siguro nga, Doc Eric, kailangan mo talagang gumawa ng Delta dance. Kasi yung kaalaman, kailangan nating labanan yung...
Oo, Dr. Eric, ako din, I vote.
Okay.
Di ba?
Sige, pre-premiere natin dito sa TVUP. Thank you, Ma'am Anthonette.
Gagawin natin public announcement. Sige.
And just to close for the tourism sector, ang dami sa akin, kasi nag-weekly chat din ako sa mga stakeholders. Tinanong nila ako noon, CEO, vaccinated ka na ba? Sabi ko, yes, with Sinovac. So nung sinabi ko yun, wala na, hindi na sila choosy. Dati kasi mga choosy, hindi po ba? May mga ganong agam-agam. At nung nagpa-vaccinate si Sec Berna, at si Sec Berna, Sinovac din. O ayan, ang problema nga namin ngayon, makahanap talaga ng supply para ma-cover lahat. Dahil yung mga taga-turismo, gusto talaga nila lahat magpa-vaccinate. So gawin nyo kaming magpa-participate kami ni Ma'am doon sa study nyo, doon sa cohort nyo na effectiveness.
Okay, Raymond, go ahead. Raymond, ang daming questions sa chat, sa Q&A. Ano bang umiiral dyan sa tanong?
Ang I'm trying to figure out if we will be calling someone from the audience po. But the very first question that we have has to do, first question meaning the most upvoted, has to do with boosters po. So I think that it's coming from the fact that if there are breakthrough infections among the vaccinated, how about those that have not yet been vaccinated or hindi eligible mabavaccinate po yung ating mga kabataan? Yung po yung yung katanungan, is it already time that we talk about the booster shots for the frontliners? How about prioritizing children 12 years old? So yun po. And also, I think the question is coming from Pfizer being given the go signal to be able to be used for 12 to 17. So yun po ang question po from our audience. Maybe either Dr. Berba or Dr. Galvez. Let's hear from Dr. Berba po.
Sige. So, booster. Booster muna yung pag-isapan ko. Actually,
sige, ma'am.
Nakinig ako talaga sa experts panel ng vaccine, yung vaccines experts panel natin. At sabi talaga ni Professor Gloriani, parang hindi pa panahon ngayon magpabakuna ng booster. Diba? Sabi, kasi when you look at the immune system and how it responds to vaccines, may tamang panahon to eh. And pagka yung booster dose mo is too soon after your second dose, parang walang effect siya. So they're still trying to decide when that will be, but it's not yet right now. She was saying something like, siguro po mga at the least 6 months or around 1 year ngayon ina-anticipate nilang mga recommendations, but that will still be depending on how things would be going. So yun, pagka too soon, yung too close from the second dose, parang walang benefit giving the booster dose of whatever brand of vaccine.
Okay.
Pwede ba mag-follow-up question, Doc Raymond?
Sige po, Ma'am Anthonette. Go ahead po, Attorney Anthonette.
Dr. Nina, kasi di ba, parang pag iniisip mo, common sense, yung mga breakthrough infections dahil may bagong variants. At yung mga bakuna natin ngayon, do not cover these new variants. Kasi di ba, nag-mutate na nga yung virus. So di po ba parang logical nga na, bakit kapag magpapa-booster, kung ang kukunin mo namang booster shot, ay yung parehong vaccine na hindi pa nagpo-cover ng mga variants na mutated. So hindi po ba ideal na talagang dapat ang booster nga it will also be vaccines na magpo-cover na nung variants na mga bago. Tama po ba yun? Anong po yan ng mga stakeholders ko
Well, kasi meron pa rin like the data I showed you from the UK, parang very strong yung evidence nila na yung current vaccines natin ngayon, particularly ang ginamit nila po doon ay Astra tsaka yung Pfizer, works well for the Alpha and the Delta variants, even
the variants. Okay.
that time. Of course, baka dumating yung panahon in the future na mag-evolve yung ating SARS-CoV-2 into a variant that the current vaccines won't be able to cover. That's really a possibility. Pero kung makikita nyo sa pipeline, yung mga nag-a-apply sa FDA, dami-dami pong makabagong vaccines that are undergoing phase 3 trials, 2 and 3 trials. So we look forward to having more platforms that will become available to fight the future variants po for tomorrow, diba? Always keep us one step ahead of this very difficult virus po.
Ma'am Nina, we have the original person who asked it, Ruperto Angel Navarro. Maybe we could ask him to provide more context doon po sa pinanggalingan ng kanyang katanungan, Dr. Berba.
Classmate kami, si Bong Navarro.
Ay, sige po. Go ahead, sir.
Hello, Nina. Yes, hello. Classmate nga kami na. Anyway, no, I was asking that question because ang Pfizer kasi ang coverage niya 16 and above, di ba? So there's this move that, in this country, I'm not saying that we're supposed to follow the US model, but, the Pfizer has already said that, they're ready for product registration. Is there a change in the coverage with Pfizer na from 16 before, ngayon pwede na hanggang 12 years old? Before we ever consider giving vaccine doses to our children, the reason why I'm asking is because, I know children don't get worse with the COVID infection, but given our current status, ECQ, MECQ, etc., hindi makalabas sa matatanda, hindi rin makalabas sa mga bata. So, ang nangyayari, ang nauutusan, yung mga middle, yung mga adolescent, yung hindi halatang matanda, hindi rin halatang bata. So sila yung mga lumalabas ng bahay, sila yung nakikisalamuha sa neighborhood. Posibleng sila kasi vectors of transmission. Sila yung nagdadala papasok sa bahay. And nobody's ever thought about that, but that's the reality on the ground. Baka mamaya, they're the vectors of transmission. And that's why we're having this surge, despite ECQ and MECQ. That's all. Okay, so...
Can I answer that question from Doc Bong?
Go, Eric, go.
Okay. Bong, unang-una, vaccination alone cannot stem the spread of the coronavirus. Okay? So kung lahat ng ating asa ilalagay sa bakuna, that will be a mistake. It should be bakuna and all the other things we're doing now. Okay? Kasama yung mga granular lockdown. Pangalawa, inuuna muna natin yung most vulnerable population. Kaya nga inuna natin yung frontline health workers, katulad mo, katulad namin. Pangalawa, yung matatanda, kasi pag sila na ospital, sobra yung complication. Malamang sila yung mamamatay. Pangatlo, yung may underlying medical conditions. At ngayon nga, essential worker, kasi we worry about the economy. Yung mga bata, kaya na-delay yan kasi nang unang ginawa itong mga bakuna, walang pag-aaral sa mga bata. At ngayon meron ng ebidensya, so nakapila na yan. Pero kailangan mauna muna yung most vulnerable. So tama ka, sapagkat pag tayo nabakunahan na, sino ba ang mahahawa? Yung mga bata na. Kaya kailangan nakahanda na rin tayo. Kaya nga inuunahan na nito mga vaccine manufacturers na ipakita na yung mga studies sila na pwede sa bata. Sa China nga, 3 years and above ginagamit na yung bakuna nila doon. Yung Pfizer nga, 12 years old pa lang. Ang kaibahan ng full approval ng FDA, pwedeng commercially available na siya. At sa US, parang nahihimigan nila doon kung meron tayong bakunang fully approved na, we can mandate. So halimbawa, sa eskwelahan, hindi kayo pwedeng pumasok kung hindi kayo bakunado. Yun ang kaibahan kung emergency use listing lang. Kaya hindi natin masabi kung tama yung decision ng US FDA, pero yun ang nangyayari sa US ngayon. Yung booster, nire-recommenda naman sa Amerika yung sa mga immunocompromised. Okay? Sapagkat kahit na dalawa yung dose, merong ebidensya na hindi pa rin maganda yung antibodies, kaya magkakaroon ng booster. At tama si Attorney Anthonette, bakit yung ginagamit nating bakuna ngayon, yun ang gagamitin mo sa booster, hintayin mo na yung mas matibay na bakuna, yun ang gamitin nating booster. Kaya wag ko kayo magmadali. Kasi nababalitaan namin, bakunado na, pumipila pa ulit eh. Okay. So, salamat Doc Bong. Thank you, Susie.
Thank you. Raymond, do we have another question?
Another
Yeah.
question, Dr. Susie. This one comes from our long time, like really one of the first ones who has been attending our webinar series, Dr. Joseph Tortona.
Yes.
Dr. Tortona.
Yes.
Go ahead, sir.
Yes, good afternoon. I would like to greet everyone good day. And especially Dr. Enrique Tayag, he's my batchmate, UARM.
Thank
Doc,
you.
wala
Nako,
kayo-
labanan ng mga classmates yata to.
May classmates at batchmates.
Walang video
Ayan.
si Joseph ah.
Wala,
Walang video.
ma'am, sira yung busted yung camera ko sa laptop ko eh. Matagal na.
Okay,
So,
okay.
hanggang audio lang.
Okay, game.
I think it got busted because of my face also. So my question is, I've been fully vaccinated since April 5, no, with Sinovac. And if ever I get a positive RT-PCR test, does that mean that I'm a carrier? Or if ever I do have a positive RT, how many times should I get tested for RT-PCR to make sure that I do not harbor the virus anymore?
Okay, good question. Maybe we're gonna ask Dr. Galvez to also answer. Hindi ko siya sumasagot eh. Doctora, please go ahead.
Okay. Even in the not fully vaccinated, yung patient na nagka-COVID, okay, we don't routinely use yung test-based strategy. More ang nire-recommend ay yung symptom. Ang tanong, nagka-symptoms po ba kayo? Okay? Kasi kung wala kayong symptoms at nag-RT-PCR kayo positive, ang routine is isolation for 10 days. Okay? Yung test-based, meaning to say a repeat RT-PCR, that's recommended for those who are immunocompromised, who may be harboring or nagiging mas prolonged ang positivity sa RT-PCR. Now, and even if you are already magaling na and you test positive, it doesn't mean na buhay pa or active yung virus, because an RT-PCR is so sensitive na even the dead virus, the genetic material which is tested sa RT-PCR will still be positive. Okay? Sa mga studies, it could, depending on your immune system, posibleng positive ka pa rin sa RT-PCR up to 3 months. But it doesn't mean to say that you are active COVID infection. Okay? So, may mga cases kami na after 2 months, positive pa rin, and then later on, nagiging negative. Okay? So, iba-iba po kung kailan magiging negative. That's why at present, we do not recommend using a repeat RT-PCR testing or swab test to say na recovered ka na. This adopted by internationally and even here nationally by the DOH. I hope I answered your question. So April, May, June, August na po ngayon, malamang negative na kayo sa RT-PCR. Hindi natin masasabi. But the short answer is we do not recommend a routine RT-PCR test after COVID infection. We use the test-based strategy in certain population of patients like the immunocompromised, yung mga HIV, okay, na we expect na mas matagal na nandoon yung genetic material ng virus. Okay. Basta of course, by the way, may I ask also, let's remind ourselves that vaccine alone is not a magic bullet. We have, as of now, vaccine and our health protocols, meaning to say the mask, physical distancing, hand washing, good ventilation. Perhaps until we reach na fully vaccinated na ang majority of our population. There's a saying, we can only be all safe when everyone is safe. Tama ba? May nagsabi na noon, we can only be safe until such time that all of us are safe. So as of now, let's try to reach vaccination, increase our vaccination rate, hopefully to achieve nationwide herd immunity. And with herd immunity, hopefully, mababawas yung circulating virus. So in that sense, we will not give the virus a chance to mutate. Okay? So parang cycle yun eh.
Thank you, Benny. Susie?
Okay.
Yeah, go ahead.
Susie, ang sasabihin ko may implications kay Ma'am Anthonette. Kasi ito, nagustuhan ko yung pinakita kanina, yung breaking through the barriers. Ganito po yun. May mga classmate, may mga kondisyon kung saan ay routinely inuulit yung RT-PCR o antigen test. Pinaliwanag kanina ni Dr. Berba, breakthrough, positive ka sa test, positive ka sa RT-PCR o antigen. Hindi pwedeng nag-symptoms ka lang, sasabihin mo breakthrough, magpa-test ka. So anong ibig pong sabihin nito? Ang ibig pong sabihin nito ay ito yung mga sitwasyon kailangan uulitin yan. One, kung merong research na ginagawa na kung saan gusto nating malaman kailan nagkakaroon ng breakthrough after na nung 14 days after na mabakunahan. So yun ang research question mo. Ginawa na yan sa ibang bansa. So linggo-linggo yung mga nabakunahan, 14 days after, kinukunan ng linggo-linggo. Okay? Kasi may mga asymptomatic pwedeng wala kang symptomatic. In the real world, dito sa atin, pwedeng i-adapt yan ni na Dr. Berba sa ospital nila at kay Dr. Galvez na kung saan yung mga bakunadong health workers ay i-follow up ng randomly, okay, kung sino yung nagkaroon ng positive test. At pwede rin yung pag-aralan ni na Ma'am Anthonette kasi ang dami na sa kanilang mga tourism workers na bakunahan. Congratulations, that's a big effort. Hindi lahat po ng ahensya nakakagawa ng mataas na vaccine coverage for the workers. Pero magandang malaman, kasi kung asymptomatic ka, hindi mo underreported ang breakthrough infections dahil sa mga asymptomatic. At kahit na yung mga nagkasintomas, ayaw din magpa-test, ayaw na nilang malaman. So dapat may mga procedures tayo na mairekomenda sa kanila, lalong-lalo na sa turismo natin. Para na sa ganon, magastos magpa-test kailangan maingat tayo kung ano yung procedures. Sana nakatulong kami sa iyo, classmate. At ang huling payo ko sa iyo, kahit na tayo bakunado lahat, we can get infected at any time. Maybe not now, maybe months from now. At pinaliwanag ko na kung bakit nagwi-wane yung ating immunity. At pangalawa, yung mga variants at yung mga darating pang variants, sana hindi. At yung ating behavior. Pag tayo ay na-expose, syempre mahawa tayo kahit bakunado. Pero alam nyo naman na mas protektado ang bakunado kesa hindi pa nagpapabakuna. Thank you, Susie. Thank you, Benny.
Thank you very much. I was gonna have a follow-up question for Nina because our audience are mainly health workers, no? And as I said, if you go back on the chat, you'll see na maraming nagkaroon ng infection. And I guess in the general population, as Eric was saying, people won't get tested, no? But for the health workers, it's very important for us to know. So what are we doing in PGH in terms of testing of the health workers? Like how regular should this be? Would you have any recommendations also for the tourism sector in terms of testing? Kasi the more we have vaccinated people, then the more we'll have people who might have asymptomatic COVID, but you don't want them to, ayaw mong makahawa sila ng iba. So what are we doing in PGH?
In PGH, we're very liberal with the testing. So meron kaming mga testing indications for any symptoms. Actually, si Dr. Raymond gumawa siya ng app na ang tawag BEST eh. So everybody's...
Ano yan?
Ano na nga ba ibig sabihin, Dr. Raymond, ng BEST?
Opo, ano ba siya? Bayanihan na employee symptom tracking system po.
Wow!
So ano na yan, in place na yan for more than a year since the pandemic started. So lahat po ng mga employees ng UP Manila, kailangan parang they go through this BEST every morning para ma-decide nila kung papasok sila or hindi. Kasi kung may simptomas, yun nga po, we really recommend na magpa-test po sila. Yun. Tapos the other indication for testing would be if they're part of a contact tracing. So some people, very active po kasi yung contact tracing. So immediately, pag kami na lamang nag-positive, tintra-track na lahat ng mga contacts. And if you're parang high risk, may tinatawag po kaming high risk exposure. That means either yung healthcare worker walang mask na dapat hindi na naman nangyayari yun. Kaya parang nagagalit kami pag may mga high risk exposure, or yung patient or yung index case walang mask at nagsama sila for kahit a very brief period of time within an enclosed space. High risk exposures po yun. Dapat napupull out po sila at natetest po sila. Kung asymptomatic.
Doc Susie?
Sige, go ahead, Anthonette. Sige, go.
Oh, sorry. Yeah. Well, just to share, no, kasi it might help the other sectors. For the tourism sector, the Department of Tourism has issued guidelines and we engage our stakeholders like for hotels. Meron talaga kaming protocols, yung sinasabi ni Doc Eric na there's continuous monitoring of the symptoms also. And once may magka-symptom, automatic na-isolate sila, merong quarantine facility na dedicate, lalo na dun sa Boracay, no? Kaya kung na-notice niyo kahit nagkakaroon ng mga a few cases here and there, hindi naman siya na out of control. So we're able to manage that. So importante talaga na may proseso, may protocols na sinusundan sa baba. At yung sabi ni Doc Eric, medyo mahal ang RT-PCR. So fortunately for the Tourism Promotions Board, when I got there last year, meron kaming special contingency fund. And I was able to deploy that last year for the first time in 5 years. Last year lang nagamit, and we used that to actually help the different local government units, tourism destinations, lalo na yung mga like Boracay, Bohol, no? Para hindi naman sila, as you said, Doc Eric, medyo mahal, no? Medyo. So we're able to, and we're thankful to DOH for setting price caps kasi at least it somehow helps regulate the expenses on that side. So yun po, Doc Susie and Doc Nina, na importante talaga yung pag-monitor. At kadalasan, ang fear kasi nila, Doc Nina, pag nag-isolate, walang sweldo. So as much as possible, we try to make provisions for those. Kahit dyan sa mga regular nating daily wage earners sa Metro Manila, yan naman po ang katotohanan na medyo nakakaawa na hindi sila magdi-disclose kasi marami sa mga kasamahan nating ordinaryong manggagawa, no work, no pay. So kailangan po yata yung safety nets natin para matulungan sila sa ganung paraan, nandun din. May mga LGUs na medyo mas masigasin dyan. So hopefully ma-encourage po yung iba. Salamat po.
Well, thank you very much, Anthonette. Nina, I picked up a question on the Q&A, and I saw several which were, let's say they got vaccinated once and then tested positive or became symptomatic. So how long after can they get the second shot? Kasi sabi mo kanina, wag silang madi-discourage. They should go ahead and get that second shot. So if they test positive, they developed symptoms and therefore got tested, how long after should they get the second shot?
Yun nga, merong yung since sa natural history kasi nung SARS-CoV-2 COVID infections, parang naturally after 10 days for mild to moderate COVID, hindi na tayo infectious. As expectedly, gumagaling na tayo. At the end of that 10 days, when we're well enough, feeling well enough, tapos nakakuha na tayo ng slot sa online registration, then go ahead and get yourselves vaccinated. Safe na po yun. Many of the, noon po, nung parang kulang yung vaccines at parang prioritize natin yung mga iba-ibang more vulnerable people. We were saying you have up to 3 months. So many people remember that 3 months kasi supposedly pag nagka-COVID ka, meron ka more or less maybe a reliable amount of antibodies against any new SARS-CoV for about 3 months. Pero ngayon, since medyo mas madami na tayong vaccines, allowed na tayo to, tama po ba? Baka iba yung sasabi ko.
Okay.
Sir Eric, allowed na.
Ganito yon. There's a compulsory 14 days isolation. Dapat makompleto mo yon. So that's one condition. Okay. Number 2, dapat naka-recover ka na significantly sa illness mo. Then at any time, pwede ka na magpabakuna, Susie. So example, nagpabakuna ako, first dose ngayon. Tapos ang second dose ko, 28 days later, depende sa brand. On the 20th day, nagkaroon ako ng infection, may symptoms na confirm sa test. So 20 plus 14 ng isolation ko. So on the 15th day, naka-recover na ako, wala na akong fever, hindi na ako nirapang huminga, hindi naman ako na ospital. So pwede na akong pa-inject ng second dose. Ngayon, kung na-hospital ka, hinahabaan mga 21 days, lalo na kung severe or critical. Thank
so
you.
ask your doctor yun, no?
Yes, yes. It's a case to case. Pero ang importante, dapat nag-isolate ka muna. Kasi I cannot imagine, pupunta ka sa bakuna center, hahawaan mo lahat. Dahil lang sa gusto mong mabakunahan. Okay.
Dapat matapos yung isolation period mo talaga.
Yes.
At hindi ka na makahawa sa ibang tao.
Okay, great.
Tita Susie, paano yung Tita Susie,
go.
kami kasi sa PPB, may yung tanong naman ng mga empleyado ko kasi annually we give pneumonia and the regular flu shots. So, Doc Eric, pwede pa rin, di ba? Pwede din.
Oh, yan. Recommended yun. Dati-rati, naghihintay muna ng 14 days in between, whether nauna yung regular vaccine, so COVID-19 vaccine. Not because bawal, but because kung magkakaroon ng side effect, hindi natin malalaman kung kanino. Sa flu vaccine ba yan, sa COVID.
Correct.
Pero ngayon, may isa lang exemption dyan. Pag nakagat kayo ng aso at baka magka-rabies kayo, okay, hindi na pag-uusapan, uunahin yung rabies vaccine. So, pwede naman magpabakuna ng COVID vaccine anytime, hindi na kailangan maghintay ng 14 days. Thank you.
Alam mo, Eric, tsaka Anthonette, no? Parang I'm trying to study and understand as putting on my communications hat, no? Trying to understand why some people think that a flu and a pneumonia shot is a substitute for the vaccine. And what I've understood, so Nina, correct me if I'm wrong here also, parang what I think people are thinking is, if they get the pneumonia shot, kahit magka-COVID sila, they won't get pneumonia. Because it's called a pneumonia vaccine. Diba? Parang ganun yun, Nina, no? Kasi sabi ko nga, parang bakit iniisip ng tao na magpapa-flu pneumonia shot na lang ako, imbis na vaccine against COVID. And I think it's because they think the word pneumonia, which of course refers to pneumonia, right, the virus, is that they won't get severe COVID if they get these 2 shots. So, Nina, can you explain that a little bit para our health workers can explain it? Of course, we want, lalo na the seniors, to get the pneumonia and the flu shot, but it is not a substitute for the vaccine. So, go ahead, Nina.
I think yung it goes back to the hesitation for new vaccines, I think, no? Yung pneumonia shot kasi at saka influenza shots, they've been here with us for a long period of time. There's vast experience on that. So people are parang kung pipili lang ako ng isang klaseng pupunta ako sa doktor ko to get shots, baka ito na yung gagawin ko kasi I've done it before, walang nangyari. I think yun yung reason for the preference. Pero yun nga po, very important to explain to your patients na yung kino-cover ng COVID vaccine is a totally new virus. We don't have previous vaccines that will protect us from this new SARS-CoV-2 virus. So magandang to go ahead and get that shot, the 2 shots or the recommended number of shots for COVID-19. Pero on top of that, get your usual yearly influenza shots and the pneumonia shots for senior citizens every 5 years or the lifetime, yung depende on the brand.
Okay, thanks, Nina. Raymond, we're reaching the top of the hour, and I think what we'll do is we'll go to the evaluation for today, which will give our panelists a minute or two to think about your parting words. So you've got lots of health workers out there, more than 2,000 on the Zoom. I think probably 1,000 more on Facebook and YouTube. And so we're going to give you a few minutes to think about your last parting messages for them. But Raymond, let's go with our evaluation.
Thank you for the riveting discussion po, no? And part of our work also is to be able to evaluate ang learnings po ng ating mga attendees. We still have a little over 2,000 attendees here in the Zoom. We, as mentioned, there might be more outside of the Zoom po. So maraming salamat. We encourage everyone in the Zoom to at least participate in this assessment poll, which has 5 questions po. First question, the panelists demonstrated thorough knowledge of the topic. So it's a Likert scale, strongly agree, disagree, and strongly disagree. For the second question, the panelists were well prepared and organized. The third question, the panelists spoke clearly and audibly. The fourth question, panelists used appropriate language with technical medical jargons adequately explained. And number 5, the panelists contributed to new perspectives and knowledge on managing various key COVID-19 health issues. So we hope that the couple of minutes were enough for our experts po to compose their final messages po to everyone who's tuned in to this webinar.
Okay, thank you, Raymond. Okay, we'll start with Tonette. Tonette, what is your parting message?
Well, I start on a note of gratitude for the opportunity to have this conversation with you. Kahit feeling ko saling pusa ako dito. Parang ako lang yung albularyo, lahat kayo mga doktor. Pero maraming salamat po sa pagkakataon. And narinig ko sabi ni Doc Edsel, all pandemics end. So we look forward to that common sense knowledge na good things end and so do pandemics. But it's important that while looking at that, we continue to prepare for it. And part of the readiness is, of course, ensuring that we all survive this pandemic so that the It's More Fun in the Philippines is something that we can carry for the country as a campaign. And as we say, it's always more fun with you guys. So we hope to welcome you back to our destinations. And in the meantime, wag nating kakalimutan na through this pandemic, importanteng palakasin ang immune system at ang ating pananampalataya sa Panginoon. I'm sure that the divine providence will always be there to keep us safe, protected, and thrive through this adversity. Maraming salamat po and God bless.
Thank you very much. That's Attorney Tonette Velasco of the Tourism Promotions Board of the Department of Tourism. Let's go to Dr. Benny Galvez of the Lung Center of the Philippines.
Okay, so the bottom line is let's all have vaccination, majority of our population, so we can attain the needed herd immunity. But as I said previously, vaccine and we still practice the standard health protocol to protect ourselves, okay? Although breakthrough infections is there a reality, it protects you from getting severe COVID infection and prevents you from landing either in the hospital or in the morgue. So majority of breakthrough infections are mild or asymptomatic. Thank you for this invitation.
Thank you very much, Dr. Galvez. Let's go to Nina. Go ahead, Nina.
Okay, so thank you very much for being here. I think the fact na all of you have joined us today means na parang meron tayong mga katanungan, naghahanap tayo ng mga kasagutan. So we're in this journey together. Sana imbitahin ulit ako, nagpaparinig ako. Pagka-ready na po kami sa aming results of the studies that we're trying to complete. Para sa ganun, mas maintindihan pa natin at eventually this pandemic should end soon. Thank you very much po.
Thank you very much. It's Nina Berba, the head of the Infection Control Unit of the Philippine General Hospital. We go to Eric Tayag of the Department of Health.
Thank you, Susie. Maraming salamat sa mga kasama ko rito, kay Ma'am Anthonette, Doc Benny, at Dr. Berba, Susie, Raymond. Sa mga hindi pa po nababakunahan, ang breakthrough infections ay hindi po ang dahilan kung bakit hindi po kayo magpapabakuna. Magpapabakuna po kayo para may proteksyon kayo at ang mahal nyo sa buhay. At para sa ganun ang ating bansa ay makausad na po. At doon naman sa mga nabakunahan po, huwag kayong kampante na kayo ay protektado na sapagkat itong ang breakthrough infections ay maaari pa rin mangyari. Subalit ito ang tandaan nyo. Kung magkakaroon ng breakthrough infections, pwedeng gamutin yan sa bahay and it can be managed. So sa inyo pong lahat, sana po ay panatiliin po na kumukuha kayo ng tamang impormasyon sapagkat pag ang nakuha nyo ay fake news, nako, hindi na kayo nabakunahan, mali pa yung impormasyon tapos i-share mo, ay hindi po maganda po yan. Kaya po ang sabi namin po sa inyo, konting tiyaga, gumagawa lahat ng paraan ng ating pamahalaan na dumating na yung mga bakunang kailangan natin. At para kay Ma'am Anthonette, may personal po akong message. Kami sa Department of Health ay sasabihin ko sa mga kasamahan ko na mas makipag-ugnay pa sa inyo sapagkat ang turismo ay malaking bahagi hindi lamang ng ating hanap buhay kundi ng ating mayamang kultura. Maraming salamat.
Okay, thank you very much.
Thank you.
Thank you so much. All right, so on behalf of the organizers, I'd like to thank all of our panelists today. You can see in the chat box, everyone's clapping and sending you hearts and whatever it is. I think we had a really great discussion today. And I think it's very clear that we have to really push for vaccination. Vaccination will protect you. All the vaccines are effective against all of the variants right now. If you got vaccinated and you have once and then you have an infection, then just finish your quarantine and get vaccinated again. I think our healthcare workers, as exemplified also by what Dr. Galvez talked about and what Nina talked about, really have to be take extra care. No, kasi kayong exposed, and yet we know that most of the time this is going to be mild. And it's going to be maybe asymptomatic. So let's just hang in there, continue to do what we need to do. And of course, I think I loved Anthonette's presentation because I think this is what we need, right? I hope it comes to a point where we can all do local traveling and local tourism, because for our mental health, it is so important to be out there, to get the sun, to be, just to enjoy ourselves kasi napakatagal na rin ng pandemya, no? So, malaki ang pasasalamat natin sa Department of Tourism na nagbibigay sila ng liwanag, nagbibigay sila ng pag-asa, at parang, parang something to look forward to. Diba, pag nakita ko nga sa chat pagkatapos ng video Anthonette, maraming nagsasabi gusto na nilang magbiyahe. Wonderful! That's our spirit, right? That should be our spirit. Parang, tiisin muna natin ang...
Gaganda! Tita Susie, ang gaganda ng mga destinations natin ngayon kasi they also took a pause from the pandemic, during the pandemic.
There you go. So, lumalabas na yung mga ibon, yung mga isda, gumagamit nila, no? I mean, this is really good. So, I'd like to thank you, Anthonette, for being with us today. And I just want to remind everyone also, no, that The risk of more serious COVID really is because of comorbidities. So it's so important for all of us, particularly health workers, to stay healthy. And remember, I asked Eric at the beginning, what do you do to relax? You all need to relax. You all need to find something that keeps you sane, na okay lang kayo. You wake up in the morning and you're not feeling low. You feel like you're there, you're gonna fight, you're gonna do this for our country, for our people. So you have to take care of yourselves, because the mental health of our health workers is of primary importance. Take care of yourselves. No one is going to do that for you. You have to take care of yourselves. You have to see to it that your blood pressure doesn't go up. You have to eat healthy food para hindi kayo magkasakit. Kasi that's one of the things we're seeing in this pandemic, that actually people are more prone to severe illness when they start out from a point where they're not healthy. So exercise, sleep early, don't smoke, don't drink, I don't know, be happy. And when it's time, we will all go to the tourist destinations of the DOT. Okay, so Raymond, am I going to cue the next week? Okay, next
Yes,
week.
segue to next week's topic na, Dr. Susie.
Wala ako doon eh. Sorry kasi pina-closing ko ako. Tuloy, nagkwento ako. O sige, next week, nako, again, don't miss it. We're gonna have a very exciting discussion. We are going to talk about the Delta variant in different parts of the world. And we know that there are many people watching this webinar, many Filipino health workers watching from, Raymond's always announcing where they're coming from Russia, from the Middle East, from Taiwan, from Japan. Most of the people who are watching us are coming from different parts of the world. And we are going to have a couple of speakers, international speakers, who are going to talk about the Delta variant and the surges that are happening outside of the Philippines. Sometimes we think, talagang dito lang talagang problema. No, it's all over the world. So we want to hear more about that. And to the extent that we can, we would like all our overseas Filipino workers who are watching to make your own watch parties, to participate in our little discussions next week, because we want to also hear from you how you are doing wherever you are. You're still part of the country, and kasama kayo sa talino na kailangan nating gamitin para mapuksa natin itong pandemya. Okay, Raymond, over to you.
Thank you so much, Dr. Susie. Before we conclude our program po, let's first acknowledge the following. There we go. The University of the Philippines System, UP Manila National Telehealth Center, UP ITDC, TVUP, the Internet Television Network of the University of the Philippines, the Philippine General Hospital, and the UP College of Medicine. Maraming salamat po for making this learning series possible. Without each and every one of you, each one very hardworking in their own right po talaga, really contributing to making sure that we have quality and credible webinar content po each and every week. And then finally, all of our Stop COVID Deaths webinar episodes, they are archived for viewing in the YouTube channel of TVUP. So you just go to www.youtube.com and then look for the TVUP channel. So this formally closes our webinar for the week. Sana po marami po kayong natutunan, and based on our assessment poll, marami po talaga nag-agree. Greater than 90% for all of our questions po, no? Maraming salamat po sa lahat po na nag-participate. 1,500, more than 1,500 responded sa ating evaluation poll. Thank you so much. Hopefully, we'll be able to see you again next week from Friday po, from 12 noon to 2 p.m. It's a date.
Together, we can stop COVID deaths.
So keep safe, keep healthy, and see you online.
The enemy remains unseen. I'll keep your hand in mine. Let's say a prayer one more time. I know you long for home, but I am here, you're not alone. I'll stay with you until the coast is clear. The other's pain before my fears, the other's lives before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? Oh God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. Just look into my eyes and say his name to realize it's fine to be afraid. Just hold on to the word he gave. This time will come to pass, 'cause this salvation's made to last. He'll carry you to see the break of day. The others pain before my fears, the others vows before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. The others pain before my fears, the others loves before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'll keep my word, your word is mine. The others pain before my fears, pushing on despite the tears. Please take us through another day. Just hold my hand, and I will hold the line. I will hold